We were the first in Northeast Pennsylvania region to offer air medical transport service. Today, LVHN partners with Air Methods to operate a fleet of 4 helicopters here in northeastern Pennsylvania.
The Lehigh Valley Health Network unveiled its newest Medevac helicopter. This helicopter is much larger and will better serve the community.
We will station the helicopter here at this airport, and then it takes about 10 minutes to get over to Hazleton Emergency Department at Lehigh Valley Hospital, Hazleton. It's 3 air miles, basically, and so that 10-minute is how long it takes to get there. Once we can activate the whole process and get them over. Once there, on site, and we get the patient loaded, then it would take 15 to 18 minutes to get down to Lehigh Valley Hospital, Cedar Crest, should the patient have to go down there.
Tell us about the attributes of this new one, why this is more beneficial to the community than the old one.
So the reason that this gives us such a huge advantage is really its size. So the cabin is doubled in space, and so that allows for more people. So when you have critical patients, a lot of times you have equipment, of course, but sometimes you need extra people. So if we have somebody on ECMO, for instance, and ECMO is a machine where basically you're using it to breathe for the patient around the lungs with the blood, and so that allows a perfusionist to go with the patient to monitor that machine and deliver and make sure it's working appropriately. In addition, a critical care transport nurse and a critical care transport paramedic. So all of those people, all of that equipment takes space, and so now we'll have the ability to actually use that space to deliver the care and deliver the patient.
You see what this means firsthand because you're in charge of emergency medicine. So how valuable will this be now that you have this larger helicopter?
Oh, this will be huge because now we don't have to rely on ground transport. We can really deliver care, even better than we have before, because now what we're able to do is transport the patients quickly, efficiently, and just deliver more care to the community. And so I'm really excited about it because it's an opportunity to even develop more of the programs that we have been developing at Lehigh Valley Hospital, Hazleton.
Our team brings the same clinicians, capabilities, and equipment of the hospital, such as those you find in intensive care units, to be continued throughout the duration of the transport. When a patient is transported, this experience is seamless, and this is the result of the highest level of teamwork and coordination. When a provider determines a patient requires rapid transport, a series of events are initiated, some simultaneously. The pilots need to determine the weather conditions exist for safe flight from both the sending location and receiving facility. The critical care team must prepare specialty equipment specific to the patient's needs. The communication staff must coordinate the arrival of the team. All this occurs while the healthcare providers at the sending hospital or location continue to treat the patient in coordination with the accepting physicians at the receiving facilities. Everyone joins together for one patient. It's truly remarkable.
Minutes definitely count. So for every minute, so for instance, for stroke and for heart are like the two main things that we think about. For heart attacks, so when you have a heart attack, what the worry is, of course, is muscle damage to the heart. And so for every minute, more and more muscle cells are being damaged. And I can't give you the exact quote on how many, muscle cells specifically. But the other thing with heart attacks is sometimes when you have a heart attack, you go into some arrhythmias, and then your heart stops, and you go into cardiac arrest, and you stop breathing, and your heart stops. And so the sooner that you can stop the heart attack, meaning open up the blood vessel, and you need to have a intervention at a catheterization center like Lehigh Valley Hospital, Cedar Crest, the sooner you can get that, the less chance of you going into this arrhythmia and dying from that. So that is really important, to get them to the cath lab as fast as possible, not only to stop the muscle damage, but also to open up the blood vessels and prevent any arrhythmias that can cause cardiac arrest. And stroke is the same thing.
This comes at a time now, this new helicopter, after some major renovations and additions to the hospital. So talk about how that fills in nicely with all of those changes.
Well, it just shows the commitment from Lehigh Valley Health Network to the Hazleton community. And with the renovations and nearly doubling the size of the emergency department, as well as the modernization of the hospital and moving to private rooms, and also with the EPIC electronic medical record system, this is the next step.
Rick Becker is a flight paramedic for 11 years. Rick, tell us, what does this new, bigger and better Medevac mean for you?
This EC-135 provides us with capabilities to bring specialty team members with us, in essence bringing the expertise of those specialists right to the patient at their time of need. In the past, we would have to take the flight to Cedar Crest to access those experts. We can actually bring the experts right to the patient. It gives us the capability of providing better patient care.
Have you had the opportunity to utilize this yet?
So we have. The day that the aircraft was delivered, it did its first flight. It definitely, it's exceeding our expectations.
What's the thing that impresses you the most?
So the additional space and the advanced technology in the aircraft is what is most impressive.
So there's 4 helicopters in the fleet, so not all of them are this size.
So we have 3 different airframes that we utilize. Each one serves a different purpose. This larger aircraft is certainly going to serve a purpose where we have to take those specialty team members with us. The other aircrafts, as you mentioned, do the job just as well. This is going to have the capabilities of taking those additional members with us.
We hope you never need to take a ride in that helicopter, but I'm sure you're going to get a chance to see inside the helicopter. It is fully equipped with everything we need, as well as the right staff and services that are required in the helicopter. So should you need it, it is a state-of-the-art, top-of-the-line helicopter that we're giving you the very best.